Okay. I'm Dr. Safwan Al Bayati, consultant ophthalmologist from Dubai. I'm the medical director of New Vision Eye Center in Dubai Healthcare City. Here we will talk about my experience with keratoconus and schwann-tamaris. I start with the schwann-tamaris for the last 6 years, almost 2010, and that was with the schwann-tamaris 500. And because we have a lot of cases of keratoconus in GCC, in Gulf, in Arab Gulf. So the first challenge that I faced as a refractive surgeon is the abnormal cornea, which we called it keratoconus or highly aberrated cornea. Amaris gives me a lot of facilities, apart from the diagnostic tools and the therapeutic tools. So I start with the Scott. That was one of the important tools. And then I end up with Cyrus. In 2003, there was a dramatic changes in a software that gives me an ability to go to treat keratoconus in more accurate way, highly selective way, in a refraction and high order abrasions. The aim of treating keratoconus, as you know, is only to normalize the cornea. This machine having the ability to select the high order abrasions, and which is most clinically significant, and to select the refraction. So through the software, the surgeon will not spend a lot of time in front of a trial, many trials. I was doing a lot of trials in front of the corneal map and refractions to get the best residual thickness of the cornea. Now the machine gives me a software that it can do it within less than 5 minutes, whether a low order abrasions or high order abrasions. So as I said, apart from the diagnostic, which gives me a beautiful screening for the keratoconus, and that gives me a traffic light, whether this patient is keratoconic, whether this patient is a borderline, whether this patient is myopic treated, or there is abnormality and abnormal cornea, and go to check the parameter. It's facilitate my life, make it more easy to go through, especially if we are saying that more than 50% of our cases, they are borderline because of the weather. We have 360 days sunlight and very hot and humid. So people, they have, a lot of people, they have allergy. And that allergy makes them rubbing their eyes. So that will change the cornea a lot. From this point of view, I have a lot of patients that they are seeking a refractive and they don't know that they have an abnormal cornea. And from this point of view, that machine gives me the tools to detect them first, accurately, sensitively, because I'm comparing the Cyrus, for example, with the other machine. And other machine and Cyrus gives the best sensitivity and high sensitivity and specificity also. Now, the treatment with the schwann-tamaris, especially after 2013, when that software started, a refractive module of the high order abrasions, it gives me the ability to treat the patient not only by treating the high order abrasions, it's by treating the refractive part of it also. Now we reach to experience how to treat those patients refractively, not therapeutically. It's too early to say that, well, we will do a refractive surgery through Amaris to keratoconus, but we are saying that we are now reached to a level that we can treat keratoconus by laser, especially those passed within our categories, within our criteria, as a candidate to our criteria through our study with Amaris, to have the best result, stable result. Definitely, Amaris provide us also with a cross-linking machine that engaged in the machine, engaged in the laser machine. that give us another options to facilitate our life. So you can imagine that. Now, patient on the table, you are doing the laser and directly just redirect the cross-linking machine by Pashki, our God give him the mercy, and then treat it directly. So I'm reducing the time and movement of the patient from side to side. Second thing is that was not the last of the last of the story. No, still we have improvement. The smart pulse or the smart surface ablation, that's what we are now talking about. The smart surface ablation, which which support the transepithelial, was one of the amazing things. I was using transepithelial mode from the beginning when I start, and I prefer transepithelial on the LASIK because it gives me the stability, it gives me safety away from all the complication of the flap. I'm not saying that I'm not doing LASIK, I'm doing LASIK, but I'm more conservative in my country with the LASIK because patients should be candidate for LASIK, to do LASIK. And that candidate have a criteria to be in, because I know that most of them, they have a predisposing factor to be keratoconus. That's why I'm strict to transepithelial. When smart pulse, smart surface ablation started, it gives me better rehabilitation time. Patient just raise his head and saying, "Wow, I'm seeing, doctor. You told me that I will wait for 5 days. Now I'm seeing, so I can see you. I can see the watch. I'm putting a beautiful watch on the wall in the theater. My theater is different colors, so patient when he's coming, he loses his fare from the colors that he's seeing. So he's just raising his head here and raising his head here. He will see a special watch on the wall, and the colors of all matching the colors of the Schwinn, all blue and white and. So from this point of view, I found that those patients start to see, look again to the colors because they start to see well. Now that's right, it will last for 5 days, and then they will come back saying that vision start to be less because of the epithelialization, and I'm saying that, well, now it will take another 2-3 days to be fine, and you will be perfectly fine. From this point of view, these facilities, which is not present in other competitors, it's unique to Schwinn Tamaris, like the selectivity of the high order abrasions, the selectivity and the ability to select the refractive error algorithmically by the machine. You are pressing one button, minimizing the depth or minimizing the volume, and this definitely needs a very low short skills duration, and then you will be able to reach to a degree to treat such highly aberrated cornea where we were unable to touch them. Still others they are doing, but they cannot reach to this level of accuracy. Other things, when I start 2010, there was a dilemma of whether we will use a track system in a highly advanced or whether that cyclotorsional tracking system was important of not. And I was saying, well, it's very important and it should be in all modalities of treatment. In other competitors, you can say that it's only in a few modalities of treatment. It's not, and it's only following the customized wavefront, ocular wavefront treatment. In Schwinn Tamaris, it's in all modalities. And the platform of this beautiful laser is aspheric in all modalities. Means that it treats the induced astigmatism for each diopter. We are inducing spherical abrasion, trefoil. It's treated by software, by its software, and they are updating. The beautiful things in this team, in the Schwinn team, that they are working daily, and we are all as a one family working daily to exchange information, exchange experience, and getting much better. And they have the ability to change, to address that experience on the machine. And that's the beauty of Schwinn team. Because when we are talking to one of the algorithmic team, he will think about it and then return back. Okay, so let us go and let us sit and few papers and few words, and then return back to apply it on the machine. And then the software will be updated and a lot of new things will be corrected. Definitely, these meetings that we are attending and Schwint Amar's meeting users, the key users, it gives the company and the attendants a lot of information. So this information keeps those attendants aware about any update and keeps them, the company through their team aware about any complications, so they can update their performance and the laser performance. And I think that now we reached to a degree that we can correct a lot of highly abraded cornea and a lot of cases that we were unable to do it. We were unable to think about that we can do laser to them. Yeah. Great, thanks.